everyone. Welcome to another episode of Persivia Perspective. My name is Nida Shahid, and I am your host. And today we have Dr. Fatima Baloch here with us, who is the product owner of quality at Persivia. So, Dr. Fatma, how are you?
I'm good. How are you, Nida? Thank you for having me.
I am good too. Thank you so much for doing this. And now, just for background, uh, quality reporting in healthcare has evolved over a compliance activity to a strategic pillar for value based care, VBC. Yet, many organizations still struggle with fragmented systems, delayed insights, and unreliable data. As we explore quality reporting excellence, we're going to be diving into the challenges, the importance of integration, and how the next gen solutions like Persivia's quality management are driving transformation. So, Dr. Fadma, my first question to you is that what are some of the biggest challenges that healthcare organizations are facing today when it comes to quality reporting?
So, like you said, one of the biggest issues is the fragmented data sources and the lack of integration and interoperability. It was also named one of the most challenging data quality problem according to Gartner. And the result has been having data stored and maintained in silos with significant overlaps, gaps, or inconsistencies. And if they're not connected, data standardization becomes so much more harder than it should be. Secondly, there is a lot of manual reporting and manual report processing, and that just adds to the administrative burden. And then consequently, there is delayed insights, and that impacts the delivery of care that the providers do to the patients. And then there's confusion around constantly evolving regulatory requirements. Like we know, CMS updates the requirements every year, and that also adds to the administrative burden.
Thank you so much for answering that, Doctor. So, talking about the industry problem and the gaps in quality reporting, I hear this a lot that quality reporting is, often seen as a checkbox and not an actual, strategic initiative. So, why is that?
So there are two reasons. First, it has traditionally been framed as a compliance task and not a strategic asset. So it often gets pushed to the back burner. And second, many organizations lack real-time data visibility. So if you can't see how you're performing until the end of the year, it is very hard to use that data to drive improvement.
So, you're saying that reporting isn't just about meeting deadlines, it's actually a missed opportunity if you don't use it to guide operations?
I exactly. When done right, it provides a feedback loop, helping teams course correct, improve outcomes, and even drive revenue under value-based contracts.
So, what does it mean to achieve excellence in quality reporting today, especially as the industry shifts towards more data driven and value based solutions?
First would be having a real-time, accurate, and actionable quality data. And as the parameters for value-based care reporting continue to change annually, being able to use a 360-degree view of your organization's data, from patient populations to outcomes to financials, that I feel is the key to success for any healthcare organization. And then data analysis and breakthrough with digital technologies will play an integral part in enabling explosive growth within BBC. Technology such as remote patient monitoring creates an initiative for a data-driven approach to medical care, giving providers actionable insights, greater visibility, and innovative ways to create value for patients, medical establishments, and healthcare in general. Another way that quality reporting excellence can be achieved, in my opinion, is the seamless integration across systems and data sources. Overwhelming, disorganized data makes value-based a non-starter for many physicians. Championing the standards and technology needed for interoperability can help with that. Standardized and interoperable data aid in the exchange of health information to support care and improve quality. Another would be enabling proactive interventions and not just retrospective reports, maximizing patient outcomes and minimizing costs. You need to be more than just a healthcare organization, but a quality improvement organization focused on continually raising the bar for both your patients and your bottom line. And finally, aligning quality efforts with financial, organizational, and clinical goals. Value based care helps reduce healthcare costs, improve patient satisfaction and engagement, and facilitate seamless coordination among healthcare providers, specialists, and stakeholders.
What are the key pillars or competencies required to achieve quality reporting excellence? Now that you have defined it, we should talk about the pillars.
So it's a no-brainer. First would be ensuring data quality. And data quality refers to the usability and applicability of data to meet the intended purpose of reporting. Analysis and decision making is also an integral part of any healthcare organization. In part because poor data quality costs organization at least $12.9 million a year on average, according to Gartner's research from 2020. And then another key pillar would be advanced predictive analytics and tools such as artificial intelligence that may inform healthcare decisions. AI and other predictive analytic methods have the potential to generate cost savings and produce better health outcomes for the organizations.